Somebody come in.
Come in.
I come in. Good morning. My name is Marjorie Hibbert. I'm going to be your nurse today. How may I address you, sir? Say Vincent.
Vincent.
Good evening, Mr. Vincent. Or morning. Today I'm going to do an assessment and inspect your abdomen. I'm going to be touching you. I'm going to use my stethoscope, and there are times when I'm going to be pressing on your belly. I'm going to wash my hands. Hands are washed. Okay, Mr. Vincent. The first thing I'm going to do is to ask you, do you have any problems with your belly right now? Or no?
No.
You go to the bathroom every day? Say yes.
Yes.
No pain?
Okay.
No constipation? Okay? Okay. I'm just going to lower this a slight bit. Okay, that's good. Okay, Mr. Vincent. So the first thing I'm going to do is what we call inspect. And for inspecting, I look at your belly. I look at it from the sides. And I go to the foot of the bed. Breathe normally. You can close your eyes if you want to. Okay, I'm looking to see the rise and fall of your abdomen. I want to make sure if there are any, looking at the size of your abdomen, the symmetry of your abdomen. I want to make sure the contour meaning the shape of your abdomen, and if there are any scars or any bruises or any bumps or any wounds or anything like that. Okay? I'm also looking for what we call the aortic bruit. Want to make sure that I'm not able to see no aortic bruit. Okay. The next thing I'm going to do is start. Okay, Mr. Vincent, I'm now going to use my stethoscope and I'm going to listen to different areas on your belly. Okay? I put it in one spot. You have to wait to hear the sound. What am I listening for? I'm listening to see what we call abdominal sounds. Okay? It's your intestines, air and stuff moving around in there, and we're supposed to hear it with the stethoscope, right? There's two parts of the stethoscope. There's the diaphragm and there's a bell. So here we go. Right lower quad, I heard. Right upper quad, I heard. Left upper quad, I heard, and left lower quad, I heard. While I'm here, since I have the diaphragm, I'm going to listen over what we call the aorta. I'm going to listen for bruit or anything. We hear a swoosh. Very good. I heard it. Okay. Then I'm going to move down. Next to the aorta is the renals. And I listen and I hear very well. The right renal, very well. Then I'm going to go down to your belly button, sir. And to the left of that, I will hear the iliac. I'll hear the iliac. And to the right, I'll hear the iliac. And below that, imaginary line, I will hear the suprapubic or the inguinal on the right and also on the left. Okay. Okay, Mr. Vincent, I'm going to use my stethoscope and I'm going to press over your liver. I'm going to listen over your liver and your spleen for venous rubs, venous hums, or friction rubs. Okay? So I'm placed there. This is where your liver is. No venous hum or friction rub. And the spleen on the left, no venous hums or friction rub. Pause. Okay, Mr. Vincent. Now I'm going to place my hand on your certain areas of your belly, and you hear me knocking on my fingers, not your belly, on my fingers. Okay? And that's called percussion, just so you know. So I'm going to start with the right lower quad. Did you feel that? Any pain?
Okay.
Okay. Okay, right, mid. Then I'm going to go here. I'm going to be very gentle over the renals, the epigastric, and the suprapubic. Then I'm going to go left lower, left epigastric, and left aorta. That would be the top.
That's the spleen, right? No.
I'm percussing the left lower, the left epigastric, and the left upper will be where the spleen is. And I am listening for tympany. Over the liver will be dullness for percussion. Okay, Mr. Vincent, it's called measuring your liver. So we start below your breast on the right side, and we percuss, 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 and it will be dull in the span where the liver starts under your rib cage here and where the liver ends on the right lower abdomen. So Mr. Vincent, I'm checking your spleen, and the spleen is located somewhere in this area. And what I do is I tap on my thing for dullness, and it would tell us if you have any inflammation in the gallbladder. I mean, in the spleen, sorry. And it would be called we call splenomegaly. Splenomegaly means that your spleen is enlarged. Okay, so that means it would be specifically obvious when I do this. It would sound dull. Okay, pause. 3. Okay, over here, Mr. Vincent, is where your spleen is. I'm checking to see if your spleen is enlarged. We call that splenomegaly. How I do that is I'm tapping on my fingers. But while I'm tapping, could you please take a deep breath in? Very good. And you may relax. Breathe out. Thank you. There's no splenomegaly. Okay, Mr. Vincent. Right now, I'm going to do what we call palpate. Means that you'll feel my fingers pressing on your belly. It won't be hard pressing, just lightly. But if I press and you have any pain, let me know. Okay? And I'll be doing it all over your belly. Here we go. Right lower quadrant, palpate, light palpation. Any pain?
No pain.
No pain. Right upper quadrant, palpation. Any pain?
No pain.
Okay. Left upper quadrant, palpate. Any pain?
Okay.
And left lower quadrant, palpate. Any pain? No pain. Deep palpation. I'm going to deep palpate. That means, Mr. Vincent, I'm going to press a little bit harder. Let me know if you feel any pain. And I'm looking for tenderness or any masses. Okay? When I did the light, I was still looking for masses as well, or any tenderness as well. Okay, here we go. So I'm pressing down on the right lower. Any pain? Okay, deep palpate. Left, right upper. Any pain? No
Okay.
pain. Deep palpate. Left upper. Any pain?
Okay.
No pain. And left lower. Any pain?
Okay.
No pain. That's called deep palpation in 4 areas. Okay, Mr. Vincent. I'm still going to press down on your belly. It's going to be deep. And what I'm pressing down is when I lift my hand up, you let me know if when I lift my hand up if you have any pain in any of the areas, okay? It's called rebound tenderness or pain. And if you have any kind of peritonitis, means inflammation in your belly, okay? So here we go. Right lower quad, deep press. Any pain?
No pain.
Okay. Left, right upper,
No pain.
no pain. Left upper,
No pain.
no pain. And left lower,
No pain.
no pain. So no rebound tenderness and no signs of peritonitis. Okay, so we want to describe if we saw any masses, the location of the mass that would be on your belly, the size of the mass, what shape it has, and if there's any tenderness. So in this case, all things are negative. You don't have any masses or tenderness. Okay, Mr. Vincent, I'm going to be pressing on your belly again. It's called palpate, as you know. And I'm going to be palpating your kidneys, which is kind of to the back, in the back area here, and your liver and your spleen. When I'm doing that, when I'm pressing down, could you take a deep breath in for me? So breathe in. Very good. Breathe out. And breathe in. Breathe out. And again, breathe in. Breathe out. And breathe in and breathe out. Okay, Mr. Vincent. In this area right here is your aorta. Remember I listened to it earlier? and in order for me to feel the borders, was it?
Awesome.
Okay, Mr. Vincent, back to your aorta. It says your aorta is located right here. And I'm just going to lightly tap with my fingers. Just left. This is your midline. And I'm just going to tap left just to palpate the aorta. Vincent, I'm going to place my hand, 3, 2, 1. I'm going to place my hand on your back right here. And then I'm going to use a fist over my hand, because I'm checking for your costovertebral angle, which is located back here. And then I'm just going to lengthen bilaterally. Okay, Mr. Vincent, I'm going to check to see if your appendix is inflamed. We call it appendicitis. And to do so, we do what is called a Rav-Singh sign. In so doing, I will press on your left side and see if when I press on your left side, if you feel any pain on the right. Okay? So I'm pressing on your left side. Any pain on your right side?
No.
So your Rav-Singh sign is negative. Okay, Mr. Vincent, I'm going to check your belly for what we call ascites. What is ascites? Ascites is a gathering of fluid, excess fluid in your belly. Okay? To do that, I have to do with my fingers like I did before, and we call tapping on the fingers. Okay? So we start with the midline, which is from this area to below your belly button, and we're going to go outward. Okay, Mr. Vincent, I'm going to check your belly to see if you have any excess fluid in your belly. We call that ascites. And it sometimes will show as an extra size to your belly. To do that, I'm going to tap on my fingers like I did before. And I'm going to go from above your belly button in this area to the outside where your side is. And then I'm going to ask you to turn on your side, and I'm going to do the same thing again. Okay? Here we go. Okay? Ooh, I'm liking your belly right about now. Excuse me. 3. Please turn on your side. Not too far over. That's far enough. Put your hands here. And I'm going to percuss. Dumbness and tympani remains the same. Okay, Mr. Vincent. I'm going to press on your abdomen again. On this side over here, on the right side. And I'm checking for inflammation of the gallbladder. And it's called cholecystitis. Okay, and when I press down, I'm going to ask you to take a deep breath. And if you feel any pain when you take your breath in, then that means that you have gallbladder problems. So here we go. Okay, I'm going to press down right here. Take a deep breath. Any pain?
No.
Oh, no pain. No cholecystitis. Okay, Mr. Vincent. I am going to press on your belly again. Right where your liver is on the right side here. And your spleen. And I'm going to check for enlargement and tenderness. Okay, here we go. So I'm pressing on your liver. 1. Okay, Mr. Vincent. I'm going to press on your belly again. Right here is the liver. I'm checking for enlargement and tenderness. And over here is your spleen. And I'm checking for enlargement and tenderness. No enlargement, no tenderness. Your exam is complete. 1. Okay, Mr. Vincent, I'm going to press on your belly again. Right here is your liver. I'm checking for enlargement and tenderness. And back here is your kidney. I'm checking for enlargement and tenderness as well on both sides. Enlargement and tenderness. Over here is your spleen. I'm checking for enlargement and tenderness. No enlargement, no tenderness in liver or spleen. Your examination is complete.